Hi everyone, welcome to this pre-recorded session. My name is Dr. Chang, lecturer of the Nursing Division. Today we have Dr. Lim, Head of Department Nursing Division, to share on the Bachelor of Nursing program at IMU. Over to you, Dr. Lim.
Thank you, Dr. Chang, for the kind introduction. As mentioned, I will run through the Bachelor of Nursing Honours Program in IMU. Well, for this program, it is actually offered full-time, and it is for the duration of 4 years. Now, in these 4 years, we have 2 semesters in a year, and therefore, there is a total of 8 semesters for this program. Now, the intake is only 1 intake in a year, which is in September. For Bachelor of Nursing program, we have actually the theory block first being offered, and then followed by the clinical posting. And when they come back, they will do their end of semester exam. So this is how each semester will be offered.
Thank you, Dr. Lim. Can you tell us why students should take up nursing at IMU?
Yes, of course. Well, for this program, our students, as I mentioned, have to undergo clinical attachment or clinical posting. For our students, we attach them to both public as well as private hospitals. Now, this is an advantage for all our students because they'll be able to experience working in 2 different settings. Because public and private hospital is slightly different in their setup, and therefore our nurses will then, upon graduation, will be able to fit into these settings. And therefore, they are much more work ready in various complex healthcare settings. In addition to that, we also post them to different units in the hospitals, like for example, operation theatre, emergency department. They also go to renal unit or dialysis unit, and this actually gives them a lot of opportunity and experience in various units. And therefore, this will then help them to be better prepared to work in any ward. In addition to that, our lecturers are also very experienced, and all of them actually have post-basic qualification. And with their vast experience working in both public as well as private hospitals, their experience is very enriching, especially when they want to teach the students and share experience, and so that the students are also able to relate whatever that they are being taught. So, in addition to that as well, other than experience and also qualification, one more very important thing about our nursing lecturers is that they are very dedicated, and they would like to share as much as possible their experience for their students. And therefore, our students will be able to gain a lot of experience to help them to become better nurses. Now, in addition to that, very unique in IMU is that IMU is a medical university that offers various medical programs, which is very rare. And this allows our nursing students to be able to be immersed into a very special environment where they are all healthcare professions. And we also encourage a lot of interprofessional learning, and this helps them to be able to appreciate the contribution of each healthcare provider in the care of the patients. And therefore, I would say that our nurses have a very engaging learning environment to cater to various learners' needs. And of course, last but not least, our students or alumni have very high employability rate, and they are also highly sought by employers. We also have incidences whether during the 3rd year of the study, we have employers already coming to sought after them. And therefore, this actually reflects the quality of our graduates that allows or actually encourages the employer to actually come and sort them. So this actually reflects the quality of our curriculum and the graduates that we produce. Yep.
Thank you for the interesting facts, Dr. Lim. What is a career pathway for a nursing program?
Yes, I think, Dr. Chang, this is a very common question that's being asked. Yeah. Now, for nursing, we have actually a few tracks. We can actually say that there is about 5 tracks that you can opt for. A lot of people think that nurses upon graduation will only work in hospital. Now, that is not true. They have actually a lot of tracks that they can select. Now, in the hospital, they can work as registered nurses, and if they have undergone specialized training or post-basic, we call it, they can actually work in specialized units. Okay, like intensive care, critical care unit, dialysis, operation theatre. So this will then allow them to work in the areas that they like and have very strong inclination to. In addition to that, once they work longer and have more experience, they can then be promoted to charge nurse or nurse manager, and they can even become the chief nurse manager or director of nursing, we call them. And we also have nurses, after working for many years, they are also consultants, or they can also become the chief executive officer to manage hospitals. We have a lot of senior nurses who are actually consultants for new hospitals. There are a lot of the hospitals, new hospitals, they will need their advice and also a lot of their experience in order to prepare or set up new hospitals. Now, in addition to that, nurses can also opt for education. Now, if they would like to opt for education, they can actually become nurse instructor or nurse educator, either in the hospital or they can actually work in nursing colleges or universities. We also have nurses with specialized training, for example, diabetic trained nurses. They are also educators and they are diabetic educators. So they have their own clinic, they have their own patients, regular patients that they see, and they will teach them as well as advise them. So nurses do not only work in the hospitals, in the clinic, they can also opt for education. Now, in addition to that, nurses can also go up to become managers, as I told you, and if they would like to become administrators, they can opt for the management track. Now, being managers does not only mean that they head the units or wards. These managers can also be in specialized area, like for example, if they like to look into quality assurance, then there is also positions such as this, which is quality assurance manager. They also have risk manager. They even have infection control manager, and etc. Nowadays, nurses, we have a lot of specialization. In addition to that, other than managerial positions, they can also opt for industry. We have a lot of nurses who works in the industry related to insurance, related to medical equipments. They also work in industry as industrial nurse. We also have nurses who move on to become community nurse, and they also become private nurse as well. And that is why there are nurses who actually branch to become entrepreneurs, meaning they open their own business. And these we have a lot of graduates who open their own nursery. They have their own elderly care home. They also have their home nursing business as well. So it is up to the nurse, yeah, to use her experience and start their own business. We also have the fifth track, which is research. Now, there are nurses who is very interested to do research, and there are researches can be carried out either in the hospitals or in the clinical area or even in the industry. And there are also nurses who head the research units in the hospital itself. So it's up to the nurse which track they would like to pursue. Thank you.
Thank you, Dr. Lim. Let's move on to the FAQ section. I have 3 very important questions from the students. Question 1, what is the difference between nurses with diploma in nursing and degree?
Yes, thank you, Dr. Chang. I think this question is a very common question. We are always being asked about what's the difference between these two during our marketing. And the difference is actually for diploma in nursing, the minimum entry requirement is actually SPM level, whereas for the degree in nursing, it is at STPM, A-level, foundation, or pre-U qualification. And even for the duration of the study, for diploma program, it is 3 years, whereas for the degree program, it is 4 years. Now, if we look at the prospects, upon graduation, currently there are countries where, in order to work, the minimum nursing education qualification is degree. Okay, and I would say that there are a lot of countries which is actually moving towards upgrading the qualification, which is degree. So if for those who have STPM, A-levels, or foundation, do pursue a degree program because that is the way forward. And also for degree program, there's a lot of teaching and learning activities that involve discussion, case-based, interprofessional learning, and this bedside teaching as well. And this actually requires one to discuss on cases and link them to conditions, medications. And therefore, this actually helps them to develop their critical thinking skills. Now, critical thinking skills is very important because when one is able to think critically, regardless in which position that they are in, when they care for the patient, they are able to think rationally on what they are doing, why they are doing certain things. And therefore, that helps actually to make sure that the quality of care is maintained. And they don't do things because they are just asked to do certain things. They actually think before they do, and they know why they are doing it. And this is very important because care for patients is now moving towards evidence-based practices. So all the nursing practices are now require evidences to support. And this is actually another way of maintaining safety of patient as well as the quality of the care that is being provided. So that is the difference between diploma and also degree nurses.
Thanks for that, Dr. Lim. Now let's move on to the next question. What is the employment rate for IMU nursing graduates?
Okay, I'm very happy and also proud to say that our employment rate for IMU nursing graduates is 100%. We have no issues in getting employment for our graduates. As a matter of fact, during even third year itself, employers have already come in to speak to our students to ask them whether they would like to join their institution. And that speaks a lot on the quality as well as the track record of our alumni. And a lot of our graduates, I would say about more than 90% or 95% and above, are based in Singapore. Yeah, and we have a lot of our nurses there who are doing very well, who have become charge nurses, sent for specialization and in the managerial position. We also have nurses who have also moved on actually to upgrade themselves and become nurse practitioners. Yeah, and we have nurses who are working in United States, USA, and they have their own clinic, and they have a lot of autonomy in seeing to their patients because they have their own clinic. They can prescribe, and they are very, very efficient in their area of specialty. We also have nurses who have gone abroad to Middle East. A lot of them are in Middle East, and they're also doing well. And we have both female and also male nurses. And I'm also very happy to say that, you know, our male nurses are actually doing extremely well. They are very, very sought after by a lot of employers. Okay, and most of them are in the managerial position as well. So with regards to employment, there is no issues with IMU nursing graduates.
All right, thanks, Dr. Lim. Let's go to the last question. What are the postgraduate opportunities in nursing?
Okay, definitely, there is a lot of opportunities for them. Nowadays, there's a lot of specialties in nursing as compared to previous time. We have nurses specializing in various aspects, yeah, from neonate, which is care of premature baby, up to the care of the elderly. We also have nurses who specializes in intensive care, in the dialysis. We also have nurses who works in scope room, and we have also nurses who are pediatric trained, and I also have nurses who have actually specialized in anesthesia. We have alumni who is currently in German, and she has a lot of interest to move on to German, and she has not only take her specialty in nurse anesthesiologist, she has also taken a lot of effort to learn German language as well in order for her to move to German, and she's doing very well there. And I'm sure there's also other nurses from IMU who has also went abroad to do their specialization in New Zealand and also in UK. And besides specialization, we also have nurses who would like to do or pursue or move to the management track. And these nurses can actually take up their MBA, which is in hospital management, because this can help them to have a better perspective on the business side, and this can help them to become better managers and also administrators. And we also have nurses who actually wanted to become researchers, and they have already moved on abroad to become research assistants, and other than finding employment in specialized areas abroad. So I would say that opportunities to pursue masters as well as PhD is abundant. Thank you.
Thank you very much, Dr. Lim, for the very clear and detailed nursing program at IMU. That is all from us today. If you would like to look for more information, please go to www.imu.edu edu.my. Thank you very much.
Thank you.